Hi everyone, it's Azusa. Welcome back to my channel. So today I'm going to talk about postgraduate program or how to get dental license in Japan for foreign trained dentists. I have gotten a lot of requests about this topic, but I haven't done this for a while because I was kind of reluctant to do it. I don't really know the person who actually got the license or doing postgraduate program in Japan, so I don't really have information. But I Googled it and I found the official website from Japanese Ministry of Health, Labor and Welfare. So I'm gonna give the information from that website. And I found that there is no English source talking or writing about how to get the dental license in Japan in English. Of course, there are several information about this in Japanese, but I couldn't find any of them in English. So let's talk about it for those of you looking for this kind of information in English. Okay, let's do this. So basically, if you want to apply for a postgraduate program, you have to get the license first. So today I'm just going to focus on how to get the license as a foreign trained dentist. But if you want to do observation in a clinic, you don't have to get it. So you can just apply for it. And I think it's not going to be difficult to get the observation position. If you just want to do the observation, just call to the school or organization and you can do the, just the paperwork. It's not going to be difficult, so just call them. That's it. So I'm not going to talk about the observation program. So today I'm just going to talk about how to get the dental license in Japan to do the postgraduate program or training or to see patient in Japan. So first of all, if you want to get the license in Japan, dental license, you have to pass the national board. So how to take national board? How do you get to the point to take an exam, right? That's the question. Because once you get the license will work in whole states. It's not like America. It's not like you have to apply for this state and that state. The one license will work in all prefectures. So if you want to take an exam, there are 3 courses. Oh, before that, the information I'm going to talk about is all from the website of Ministry of Health, Labor and Welfare. I'm going to put the link in the description box, so please check it out, but it's all in Japanese, so you have to read it. And it's very complicated, so I'm sorry if my explanation is not clear for you today. I don't really have a confidence if I can explain clearly, but I'll try to do my best. So first of all, there are 3 courses you can take. The first course, you're gonna go back to undergrad dental school. It's really easy. Once you graduate dental school, you can take national exam as Japanese dental student. But it's very time consuming and depends on the school though, but the money is not cheap. But it's the easiest, simple way as always. And the second course is you're gonna be qualified. You have to be qualified to get the national board. And the third course, you have to be qualified to take pre-national board exam. I don't really know how to call it in English. In Japanese, it is called yobishiken, 国家試験 yobishiken. So I'm just gonna call it pre-national exam. I have my scratch paper here. So to take a national board, you have to have a foreign dental license for sure. And also you have to pass the Japanese exam N1 level. And after high school, you have to have more than 6 years of education or 5 years with 5,500 hours dental education. Basically, that's the requirement to take dental national board examination. And on the contrary, for the pre-national board exam, you don't have to have foreign dental license, but you have to have a dental education, of course. After graduating high school, you have to have more than 5 years of education and more than 3,500 hours of dental education. And also, of course, you have to have N1 level Japanese skill. Okay, that's the basic thing. And if you decided you're gonna go to national board pathway, you have to get this paperwork done by March or July. And you're gonna get the Japanese test October. So basically, this Japanese test is to evaluate the candidate's ability to take medical and dental history and making a chart, making and writing a chart. There is going to be a 4 examiner from operative, pros, OMS, and ortho, 1 from each. And there is a reading, speaking, listening, and writing examination. For reading, you're gonna read dental kind of textbook, I guess, or paper, and if you can understand properly what kind of topic they are talking about in the paper. And for speaking, they're gonna check how you can explain what kind of treatment you're gonna do for the patient, or if you can discuss about the cases with other doctors. For the listening part, they're gonna check if you can understand what patients are saying, patients' complaints. In the writing, you're gonna be checked if you can write the chart properly. And also you have to do the diagnosing part. Basically, you have to get the information from extra and intraoral examination. So that's the Japanese exam you have to do. So it's totally different with that. And one thing, I don't really know how difficult this exam is gonna be, but basically you really have to have high level Japanese skill. And if you passed those paperwork and Japanese tests, and you're gonna take a national exam around February with other Japanese students. And I'm gonna talk about what kind of pathway you have to go through for pre-exam, for pre-national exam. So you're gonna do the paperwork done by March or July. And if it's passed, you're gonna have the pre-exam somewhere between June to November. There is a part 1 and part 2. So part 1, which include anatomy, histology, biology, biochemistry, and immunology, and pharmacology, pathology, microbiology, and public health, which is a part 1. It's more like a basic medicine. After that, you're gonna take part 2, which is the oral maxillosurgery and cross-operative and ortho and the pediatric dentistry. That's the part 2. And after you pass the part 1 and part 2, you have to have a clinical exam, which has an OMS, operative, pros, and ortho as well. So after you finish the part 1 and part 2 in the clinical exam, you have to have more than 1 year of clinical training. And then after you finish the clinical training, you're gonna take a national exam with other dental students in February. So which is gonna be a long way. You have to be really serious. I got many DM from you guys like, I'm gonna go to Japan and I have to stay there for a while because my husband got work in there. So what kind of thing I can do, or what kind of postgraduate program I can think about. After watching my video, you may think, okay, this is not gonna work for me. I'm not gonna stay there forever. This is too much thing to do just for several years. If you think so, one thing you can do is, like I said before, you can go to observation program. You're not gonna see your patient, but you can learn a lot of things observing clinic. That's another opportunity. And also, what you can do if you want to contribute Japanese dentistry, you can work as a dental assistant as well. For example, in America, there are registered dental assistant, right? You have to kind of have license to do dental assistant. But in Japan, there is not such a system. So if you want to do dental assistant, you don't really have to have anything. Of course, you cannot take x-ray like registered dental assistant, but you can work in dental clinic without getting any qualification, and you know how to treat patients. So you can talk to patient treatment plan, you can do consultation, and you know how to sterilize tool or how to organize clinic. So there is a lot of things what you can do with the knowledge you have for now. So if you're gonna live in Japan for just a year or so, I'm just gonna recommend you to do dental assistant? I'm telling this because I was asked if I'm gonna live in Japan for just a year, what are you gonna do? So just for a year, I think it's gonna be so difficult to get the dental license, but you can work as a dental assistant. I don't know if I could answer all the questions I got from you guys. First of all, you have to be very fluent in Japanese. That's the first thing you can do, and then you can talk to the ministry or university to discuss about your option. Okay, hopefully I can help you for somewhat. If I got more information, I'm gonna update. Thank you. Bye.